Good afternoon, everyone, and welcome to the Systems and Sustainability Echo. My name is Shreya Prasanna, and I will be your facilitator for today's discussion. Some housekeeping before we get started. These sessions are enabled for closed live captioning. If you'd like to view closed captioning for this session, please navigate to the bottom of your Zoom window and select the Show Captions option. You may need to click on the three dots or more menu at the bottom right of your Zoom control to find this. If you're having trouble accessing captions, please chat Echo IT. We're recording these sessions for later distribution through the BeWell YouTube channel. Any info you put in the chat will not be shared on those recordings. As always, please stay muted unless you're speaking, and we do encourage you to speak. If you're joined by computer, your mute button is on the bottom left of your Zoom controls. If you're on the phone, just press *6. We encourage everyone to join by video for the discussion portion of our session. That said, regardless of how you've shown up today, we're just happy you're here to learn alongside us and share your perspectives in today's discussion. Please note that no private health information is allowed in either the chat or our discussions, and that includes sharing names, exact dates, relationships, or medical information in any way when someone could identify that person. To help us with attendance, please enter your name, affiliation, and email into the chat function. We appreciate your support in helping us fully capture this record. To all the BeWell Texas providers, please make sure that you identify yourselves during the session, or if you're joining via phone, please email your phone number and name to bewelltx@uthesca.edu. Towards the end of the session, we will send out a link to an evaluation survey. Please fill it to be entered into a drawing for a $30 Walmart gift card and to give us some feedback on ways to improve these sessions. Our didactic today is about from litigation to impact opioid abatement initiatives in Texas and will be presented by Dr. Douglas Thornton, Amanda Lopez, and Angelica Inglis. After that, we will have some announcements and hear a systems case from our learning community. As always, I encourage you all to share your questions, feedback, and guidance for the questions raised by a case presenter today. We're all teachers and we're all learners in this space. And with that, we will start with some introductions, followed by didactics and announcements and case presentation and open discussion. So some introductions. Matt.
Hi, folks. I'm Matt Rosa, member of our hub team, backgrounds in clinical social work, agency administration, also worked as a government planner, and I now work full-time as a consultant. Most of my work is in quality improvement, process improvement, a lot of implementation science in systems, states, cities, large organizations, and small organizations as well. So glad to be here with all of you.
Thank you so much. Leslie.
Thank you. I'm Leslie Manson. I'm a licensed clinical psychologist. I'm an international subject matter expert on integrating substance use, mental health, behavioral health, and medical care treatments. And I provide consultation in the US and internationally, but I'm also a clinical associate professor and chair of integrated initiatives at ASU. So I do a lot of different work in terms of training and consulting and educating. I'll go ahead and pass it Kathy.
Hello, everyone. I'm Kathy Hudgens. I'm LMFT LPC. My background is in program building, program development, training. I do a lot of work with state and local and federal state health policy, especially related to integrated care and substance use treatment disorders.
Thank you so much, Kathy. Andrea Hebler.
Hello, everyone. My name is Andrea Hebler, and I'm one of the program coordinators here at CSAT. Thank you. Welcome, everybody.
Thank you. Doug.
Hello, my name is Doug Thornton. I'm an associate professor at the University of Houston College of Pharmacy, and I will introduce myself more thoroughly when it's my turn to talk, I guess.
Thank you so much. Amanda.
Good afternoon. My name is Amanda Lopez, and I'm the director of the Texas Opioid Abatement Council at the Texas Comptroller's Office. And like Doug, I'll introduce myself a little bit more once we get into the presentation, but thank you for having me today.
Thank you so much, Amanda. AJ?
Yes, hello. My name's AJ Inglis. I'm the Communications and Community Engagement Specialist here with the Opioid Abatement Fund Council at the Controller's Office, and I'm a licensed clinical social worker, also with a background in program development. I'm excited to be here today.
Thank you so much for joining us. And we have a new program coordinator at CSTAT. Jasmine, if you could please introduce yourself.
Yes, hello everyone. My name is Jasmine Vidal. I'm a new program coordinator here for CSTAT. I'll be working alongside with Andrea, and I look forward to learning all the amazing work that is being done in our community. Thank you.
Thank you. And with that, we will move on to our didactics. Karen, if you could please share the presentation, and Doug, whenever you're ready, you can take it away.
Yeah, sure. So again, good afternoon now to everybody. And thank you for the invitation to be here. So my name is Doug Thornton, like I said. I am a pharmacist by training, did a year of pharmacy residency in Huntington, West Virginia during the peak of the prescription opioid crisis. Got involved a lot in opioid-related research, particularly prescription opioid-related research. Was given some good advice by some mentors that I needed to go back to school, which is, sometimes not necessarily the best thing, but it was definitely good advice. I went back and did my PhD in health services and outcomes research at West Virginia University for 4 years, and worked in the hospital there at the time. In 2017, graduated and came to Houston, University of Houston specifically, in the College of Pharmacy. In 2018, I founded the Prescription Drug Misuse Education and Research Center. And from there, we've really been engaged in our local communities as well as statewide in a number of different projects, and had the opportunity to, in 2021, be nominated for the Texas Opioid Abatement Fund Council, representing Region 3, which is the Houston and 8 other surrounding counties. And so today I'm here with 2 experts, 2 heavy hitters, and 2 people that I'm very thankful for because I'm on paternity leave technically. And so they are here to put on a great presentation, and I will help fill in the gaps from kind of a more clinician or academic angle. And we're happy to take plenty of questions. But I see today going, again, there will be some brief introductions. There's going to be a presentation mostly by AJ and Amanda, and then I'll describe some of the processes for how we've made some of the decisions and the steps we're taking. There will be a case presentation, and then we'll open it up to questions and answer sessions from all 3 of us. So with that, that's enough about me. I'd like to turn it over to Amanda and AJ. And like I said, like Amanda said earlier, she's the director of the Texas Opioid Abatement Fund Council within the Comptroller's Office. So Amanda, I'll turn it over to you.
Thank you so much, Doug. And Doug is a beautiful example of the level of expertise that we're so grateful to have here at the Controller's Office with the makeup of the council. So a little bit about me. I'm a licensed attorney. Previously, having been in our Fiscal and Agency Affairs Legal Services Division here at the Controller's Office, as the Controller's Office holds many roles here in state government. And so one of them is overseeing different grant or loan programs. And so the legislature in 2021 decided that the Comptroller's Office was going to be the place where the opioid settlement dollars were going to arrive and then be distributed in large part by this governing body. So come with a background of state fiscal law and administrative law to be able to help build the system that's hopefully going to last the duration of these payments, which we'll get to in a moment. And so with that, I want to also give an opportunity for AJ if she wanted to share a little bit more about herself. If not, we can go straight into the presentation.
I think we can keep going.
Okay, great. All right, so then on the next slide, we're going to start with a little bit of background in the context of before 2021. So even I think as early as 2017, 2018, the local governments began their own litigation against the manufacturers, the pharmacies, those involved in the opioid epidemic. And then the state of Texas, through the state attorney general's office, stepped in to help facilitate statewide negotiations. So then as a result of all of that, as early as 2021 is when, during that legislative session, the entities came together to try to decide what a new structure of funding would look like. And though, while acknowledging that litigation is still ongoing, so even as of this year, as of 2023, there's still ongoing litigation with settlement funds not yet settled and bankruptcy plans still not settled. And so we understand that this is still a living and breathing issue in Texas at the litigation level as well. So then on the next slide, I'm going to talk a little bit about that enabling legislation. Senate Bill 1827 from the 87th legislative session, that was in 2021. And the reason why the legislature decided to create a new system in large part is because the way that settlement funds traditionally flow would mean that the legislature would dictate all of it. So that's the general revenue process. So this new bill then created the process for a separate governing body to oversee a large portion of it. The legislature is still maintaining some control and decision making, as well as the local governments getting to have some control and decision making over the way that they use those funds to abate the crisis. And that mapping was done again through the litigation process, through some documents the legislature utilized to give themselves some intent, some understanding behind the way the parties wanted to see this happen. So those kind of intent documents are called the Texas Term Sheet, Texas Global Settlement Agreement, and the list of allowable uses of opioid abatement funds. So collectively, those documents explain kind of the how to structure this new settlement funding flow, what were going to be the key uses that the parties collectively agreed to in terms of acceptable practices. So then on the next slide, now I'm going to talk a little bit about the council. So, and then kind of where Doug fits into this. So the way that the law outlined the makeup of this governing body was first 14 members, but really only 13 because the controller sits as the chair, but in a non-voting role. And again, very prescriptive in the law in terms of their background, which I'll get to in a moment, but they're also appointed from across state government. So they can be appointed from the governor, the attorney general's office, the lieutenant governor, the speaker of the Texas House, or like Doug through the Health and Human Services Commission, had a requirement to look to the regions of Texas. And this is a different regional map. So that's why we're highlighting it here. It's the Regional Healthcare Partnership region. Again, from the settlement agreement, the parties looked at this map as the one that they wanted to utilize to understand how to break up not just the council membership, but also the flow of funds. And so that's collectively how we get our council members through that appointment process. And then on the next slide, we'll talk a little bit about how the law really lays out that this council needs to be diverse. So we have in law the requirement that they come from academia or the medical profession with significant experience in opioid intervention. Right. And we also know we need to have them be current or retired healthcare professionals, as well as an employee of a hospital district, as well as a member of law enforcement. So appreciate that the reflection of this crisis not affecting just one area is also represented in the council. So then on the next slide, we're going to go into the flow of funds. And this is really what I wanted to spend a lot of time on, at least for what you're going to hear from me, as this is the most complicated part of this process. And this is an infographic we also have on our website. So for those that maybe want to be able to make this larger or be able to utilize it or print it and share it, please look to our website for this resource as well as other resources. So this infographic was established to try to capture an example of how the funds were going to flow, utilizing the number that Texas expects to receive after 18 years of payments. And that's because one of the settlement agreements has an 18-year payment schedule starting in 2021. And so we're almost about to receive that year 3 payment from that settlement agreement. So after all the settlement agreements that we know that have been finalized, we expect to receive $1.6 billion flowing through Texas. And as I mentioned before, the legislature created a separate process for these funding streams. So think about this in terms of, now we're going to go to the purple in terms of funding streams, buckets, lanes on a I-35 highway, they all have their separate tracks to be able to follow, and then separate entities that are directing the way those funds flow. So when we drop down to the purple, once the state receives them, it gets divided. First, it gets divided to the opioid abatement account. That account sits with the legislature to decide. So our state senators and representatives will go through their regular appropriation process when they meet here in Austin, the Capitol, every other year in odd-numbered years, to decide the amount of money that's being set aside in that account, how it's used to abate the crisis through utilizing state agencies. And that's about 15% that comes into the state is getting set aside for that process. So the bulk of it, like I said, 85% is then going to go to the Opioid Abatement Trust Fund. And that trust fund sits with our sister organization, state agency, the Texas Treasury Safekeeping Trust Company. That is an agency that's acting like our bank, the holder of the trust fund, so that it can sit outside of that appropriation process and allow our office to get those funds out the door in a not restricted timeline in terms of having to wait for the legislature to direct us. So we're going to drop down now to the blue level, and that is meant to describe how the money that's in the trust fund is flowing out. So first, there was a one-time requirement by law to see $5 million go to the Texas Access to Justice Foundation, and that is a foundation that is tied to the Texas State Bar that provides legal services to those in low-incoming or indigent populations. And so that $5 million, again, was carved out by law to have entities receive money to be able to provide legal services and civil legal matters for those communities that have been affected by the opioid crisis. And then there's a direct allocation to cities and counties, municipalities and counties. And that's about 15% of what the state brings in. And that first distribution was actually made this past March, in March of 2023. About a little over 1,400 entities were made funds available to them to be able to utilize in abating the crisis in a way that was meaningful for each community. And so all different amounts, and those amounts were sent to our office and to the trust company, again, through the legislative process, having the legislature looked at the intent documents, again, that I referenced, to figure out exactly how much each community should receive percentage-wise. And then once we had a dollar amount, we could do that math to see those funds flow to those communities. So those are funds that are out there already being contemplated by communities on how best to utilize. And then again, a big bulk is still sitting there with the trust fund. And now we're going to drop down to the red to understand how the council is coming into play to direct those funds. So one sliver of the funds that are in red is set aside for administrative costs. So to the comptroller's office to be able to oversee and provide those administrative services, about 1%. And then there's an allocation to hospital districts. This is where the law gave discretion to the council to be able to figure out a formula to understand that the hospital districts had a role in the litigation and seeing these funds come to the state of Texas and were also impacted, or are impacted and were impacted by this crisis. And so the council right now is working on what a formula could look like, and then we'll through that process, once they have something, and continue to receive information from experts and stakeholders in that space, we'll present it to the public and have another opportunity for public comment and public input. So that's a moving process. And so again, keep an eye out for more activity from the council if you're curious about that hospital district formula. And then the remaining amount is going to be for the council to distribute through an application grant process. So now we're going to drop down to the gold. The council on an annual basis has to see these funds flow through a targeted approach, about 25%. That's that smaller amount. And then the majority of it needs to flow 75% through the regional allocation process. So again, that 20 region map that we showed at the beginning, each of those regions, similar to the cities and counties, each of those regions also have a percentage share. Again, a metric that the council needs to see that that community is getting that percentage allocated to them on an annual basis. Again, recognizing that all of Texas has needs, varying impacts. And again, the legislature spoke to exactly how much each region then should at least attempt to receive, though giving the council some grace to be able to move funds as appropriate if a region has more need or a region has less need. So that was a lot in terms of all the colors and the funding flow. Again, happy to take questions about how this works as we move through, but appreciate your patience as I try to walk you all through this infographic. And everything that majority of what I explained is also then tied in the text along the side and along the bottom. All right, so then on the next slide, going to go into the role, and this is where I'm going to give the high level, and then I'll also ask Doug to speak a little bit. So the law, again, we quote it because it really gives us that clear direction, is that this process is meant to provide for a fair process. It's meant to actually remediate the opioid crisis in the state, and we need to be efficient and cost effective with the methods. And so the council has to select funding priorities, and it has the requirement that they be evidence-based. Though it doesn't define those things, again, the council having the ability to understand what it means for them. And we know we have to create an application process and then award the funds. And again, we know we need to follow a regional and targeted allocation approach, as I mentioned before in that slide, because of the requirement for the funding flow. Doug, is there anything else you'd like to add, just kind of generally about the council's role?
Yeah, I mean, I'll be happy to provide more details, especially if there are questions. But I did want to say this is where a lot of the work we have been pushing out to the work groups we formed. And I don't know if anybody on the call has been able to attend the public meetings we had. We had one as recently as Monday. But in case you haven't, because you have lives and things to do, we essentially have had four working groups for probably about the last 6 or 7 months. They're the peer review group, where we are identifying peer review priorities and how we build that process. 2, what I call practice mapping. AJ or Amanda, you can tell me what the actual name of that is, but essentially it's linking what those allowable uses are that was mentioned earlier to evidence-based practices, because what was written in that document are sometimes very broad categories, and we need to think about, well, how are we actually applying practices or things that can be implemented, not just broad ideas. The third and fourth one, I'm not actively on, so I'm not quite as detailed about their I guess inner workings. But we have an ethics work group and then a hospital districts work group. On Monday, we just voted to add. Did we vote to add 1 or 2 more work groups?
2 more, and we have a slide on that too, Doug,
okay. Sorry,
to highlight all that. No, but it's great. Again, everyone can tell Doug's excited about how we understand this heavy lift of the council is being broad. And so I appreciate Doug highlighting the fact that the council then decided for themselves, let's take this into smaller bites and create smaller groups for discussions and ideas to be bounced off of each other, and then present something that's a little bit more fleshed out to the full council. So that's been done in various spaces. And so if we can go on to the next slide. Because this is, where Doug was going to also highlight the fact that we know we have this list of eligible uses, again, from the intent documents. And so we're treating that as a guide. And so Doug was active on the cycles and strategies working group. So if you want to talk a little bit about that experience, about how that group has utilized this to develop categories and then to organize.
Yeah. So essentially, and sorry, I got ahead of the slides a little bit, but we have these documents that have been provided to us, and it's up to us as the council to, and really our work group specifically, to help turn these lists of things into potential projects that could be applied for, essentially, or make it easy. The goal is to make it easier for people that are applying to be able to write good applications. That is kind of our main motto in that work group, is we want to make it as easy for applicants as possible, because that's how we feel we're going to get the most number of applications as well as the highest quality applications. And I've spent a lot of time doing peer reviews for lots of organizations, from NIH, PCORI, the Canadian Institutes of Health Research, etc. And it's much easier to review good applications than it is to review bad applications. And so that's kind of our main priority, is making it as easy as possible for when the time comes to solicit applications, that we can do that effectively.
Great. If we can go to the next slide. This is where we're going to, yes, get into some of the highlights and talk a little bit more about those working groups. So as I mentioned, the law passed in 2021, officially creating this funding stream and this governing body to then make the decisions on the grant process. But we didn't have our full council until a year later. So summer of 2022 is really when this program got off the ground. And then, as I mentioned earlier, the distribution to cities and counties, that was about $47.1 million went across Texas. And then just as recent as this past summer, in June, the council voted for the adoption of their rules, which holistically outlines their process for the grant. But it doesn't give the significant amount of detail, because that's still, as Doug mentioned, exactly what types of projects are getting funded and the exact timeline. That's not for the rules. It's thinking of in terms of the blueprint of the house, right? That's what was adopted and passed in June. And so please go look again on our website. There's also a summary document there to walk one through. If there's a particular section of the rules that you're curious about, one can go in and read. For example, what would one expect to see in a notice of funding availability? We've outlined those elements. What's the life cycle of the application? We've outlined those elements. The requirement of reimbursement, those are other elements. So if we could go back to that previous slide, though, I wanted to sit on it for a little bit longer. And touch on the hospital district working group and the peer review working group.
Amanda, sorry, I
Yes.
think Karen is experiencing some technical
Oh,
issues
okay,
and
that's
she's
why.
trying to
Okay.
fix it. Apologies for that.
No worries. I think I have that slide memorized. So like Doug was saying, so yes, the council had 4 working groups: the cycles and strategies working group, the peer review working group, similarly situated to try to help the council understand what would a secondary review look like of these applications, what would be the expectations of those individuals sitting in that capacity to provide that second look and feel confident in that second look. And I already talked a little bit about the hospital district formula and how that working group has produced something that was discussed on, again, as Doug mentioned, as early as Monday. And so you'll be seeing more fruits of that working group in the next month. And the code of ethics. So of course, we can't do any of this without ensuring that we are being transparent with this process. And so we're still working through exactly what a code of ethics, and again, would then similarly like the hospital district formula, once a concept is created from that working group, it would go to the large council to then formally be adopted. And then the 2 other working groups that were created this Monday, one specifically to go into the notice of funding availability, the NOFA, which is going to be that main document that announces what is the strategy that's being funded and under what category, and what are going to be the expectations for outlining a successful application, meaning the state agency requirements as well as substantively what needs to be in the application. Also that working group is going to attempt to address then the rubric for which these applications will be graded on, as well as reporting requirements for the type of projects that are going to be funded. So that is another working group that's, as Doug mentioned, with the cycles and strategies one, has a heavy lift of trying to make the review part of the application process as seamless as possible for us and for the public, so they can know that these dollars are really going to make meaningful impact. And the other working group that was created on Monday is a short-term strategies research approach. So we're wanting to better understand what's happening across the country in terms of different ways different states are being able to utilize these funds in either a more targeted or more narrow approach, just so that we are doing our best to say we are looking at all the different ways that these funds can flow out to Texas. Another big thing that I'm actually personally excited about, again, while the controller's office is new in the SUD space, we acknowledge that. So we went and seeked out the support of the University of Texas Health Science Center, School of Public Health out of Houston. And so they, over the summer, provided us with a survey of services across Texas in the opioid abatement services space. So some of y'all, even on the call, may have heard from UT Health on our behalf. So appreciate your participation and your cooperation through that process. As the council did want to know, where are all the services? You know, where are they? Who are they providing? What issues are facing them in terms of capacity to serve and the populations that they're trying to serve. So that is hopefully going to be completed by the end of this month to then be able to share with the council and the public. And the other piece that we contracted with UT Health is a literature review. The services, those eligible uses, the strategies that we outlined that the council's looking at as the starting point. UT Health is reviewing the research, reviewing the evidence behind all of those potential options. So again, the council can see that they are selecting things that are either promising or have some research or have some data behind what they're seeking to fund. And last but not least, the last bullet I do want to pass to AJ, as she was so instrumental in making sure we have a opportunity to engage the public.
Great. Thank you, Amanda. So I'm really proud of this last piece. You know, something that we heard from the council as well was they wanted to know from the general public and from providers like all of you, how they would like to see the funds be prioritized, and which strategies they felt like were kind of most pressing with the opioid crisis currently. So we have a public survey. I'll put the link in the chat as well, but it's on our website and takes about probably less than 10 minutes to complete. And that's just a way for anyone to be able to share their voice in how these funds should be utilized and prioritized. So this information will be shared with the council along with that information from UT Health, so they can have kind of a comprehensive picture of what's most pressing to be able to make some of those decisions around funding priorities. So I was super excited. We already have 100 responses, probably a little over that in just a couple days, 2 days since it's been open. So please feel free to share that out with your communities and stakeholders. And we should have a kind of social media toolkit that's going to be coming out shortly as well to provide some additional resources for folks to share out. So that's all I have.
Yes, and then Doug, please, let's talk about all the working groups and anything else you wanted to add about the council's work over the year. Yeah, now it's been over a year since our first meeting in August of 2022.
Yeah. So I always think, because we've done a few of these presentations now, and I try to put myself in the seats of the people who are attending. And so your big questions are probably, well, what the heck have you all been up to, or what the heck's going on? And so that's a fair question. And I think that the way we've discussed it over the last few meetings has really been, like Amanda said, this is an 18-year time horizon for this program, at least. And we all know how CPRIT started and how they have been able to continue efforts needed through legislative support, appropriation support after their initial time horizon. So I think we had two main priorities. Well, one was getting the system built that could be sustained after any one of us as individuals is gone for whatever reason, because 18 years is a long time. Things happen, people move on, etc. We wanted to build a system that was functional and it lasted, and we could have some interchange in terms of people, but the systems and the processes and the structure would be there to last. And you all being an implementation science heavy group, I would hope that makes sense and is in some way appreciated. However, we also have recognized and do recognize that there is an expedience to this issue. And so that's why we're really focusing this year on making sure a NOFO is sent out, making sure the funding, which has already been, there are multiple buckets of funding that are applicable to this presentation, and Amanda went through those. Some of them have already been dispersed. And I think that's a little bit of lost in the shuffle in some things that, the settlement funds have started to disperse, but the application, derived settlement funds have not yet. And so that's really our goal for this year, is to get those NOFOs built, get the rubrics made and reporting requirements made. Oh, I'm being hurried up. We're running close on time. All right. I'll be happy to answer any questions you all may have, and we've been hard at work, and I thank Amanda and AJ for helping me with the presentation.
Thank you so much. And thank you all for a wonderful presentation. And we'll have more opportunities as we move on to the case to discuss this a bit more. I just wanted to take a minute to go through some quick announcements from our program before we move on to our case. Karen, if you could please share the announcements. Thank you. The Center for Substance Use Training and Telementoring provides high-quality education and best practices for responding to substance use. CSTAT can help enhance professional knowledge and self-efficacy to screen, treat, and make referrals for people with substance use disorders. To learn more, please visit us at cstat.uvisca.edu. Next slide, please. To claim your CME credits, you must text by tonight. Please text attend 1009-5000 to 844-502-1338. You must text by midnight to receive your CME credit. Next slide. We are at CSTAT are starting 2 new echoes. The first one is on behavioral health, which will be held every last Friday of the month. We will be starting tomorrow, so please make sure you join us. Next slide. The second echo is on recovery science. This is a research-focused echo, which will help grow a diverse work field skilled in conducting recovery science research. We will be meeting every third Wednesday of each month. Please do join us. Our first session is on October 18th. Next slide. Save the date. Texas is happening in Austin next year from February 29 to March 1st. Please visit texas.org to learn more. Next slide. And finally, our next session, it will be on Thursday, October 26th. Please do join us. We have an interesting session lined up. Thank you. And I will now pass it back to you guys, Amanda, AJ, and Doug. If you could please let us know lay out your challenge. What is your challenge? And what would you like to learn from our learning community today, and how we can help you?
Great. Yeah, thank you. I guess what I was getting to is what we're doing, what we're trying to do in the short term. And really the case that we provided to you all, or I guess provided to the committee, has this case been shared with the attendees or no? Okay.
No, we don't share the case, but we will just, if you could just summarize what your challenges are right now.
Sure.
And,
Well,
yeah.
our biggest challenge, or I guess what we would come to you and ask for your, expertise in some ways is we've obviously are building a grant, a granting entity within the state of Texas. And so our question that was provided, and thank you, AJ, for putting this together, when deciding to establish a grant opportunity within your organization, what steps did you take to identify priorities?
And I can give a little bit more context to that as
Yeah.
well. So kind of as Amanda and Doug spoke to earlier, we're kind of gathering all of this evidence, right? So the council can make an evidence-based decision about kind of what the initial funding opportunity will be. And so, I feel like we've put in a lot of good legwork in terms of getting that report from UT, having the public survey. We've been meeting with other state agency partners that are kind of involved in the opioid abatement world, meeting with stakeholders and partners to learn more from them. So kind of gathering all of this information to bring to the council so that they can use their expertise to make the best decision possible in terms of what the first funding opportunity will be. And so I guess the question that was kind of coming up for me and that I kind of posed along with some input from Amanda and Doug is, are we missing anything? Is there any other information that we should be gathering or thinking through to identify which kind of grant opportunity or program might have the biggest impact on the opioid crisis now? So that just kind of gives maybe some additional context to what got us to that question.
Yes, thank you, AJ. Yes, when we sit down and have all the data, what should we be asking ourselves? And then also another plug, in case you didn't catch it, please fill out that survey because again, that's a direct way for us to tell the council what are the priorities in each group and what kind of where to start. Because as we know, and again, even just looking at through the list of eligible uses, it's not just an approach in treatment, it's not just an approach in recovery support services or prevention, public safety, workforce development and training. So even the categories that the council adopted formally in the rulemaking process to try to organize the thought process behind types of funding opportunities is very broad. So acknowledging that there is not a silver bullet way to solve this crisis, but where are some and how do we find those, or what's a more meaningful metric to try to target?
I might just, in simple language, there's two potential questions that people might be contemplating. One is the what do you vote for question in terms of what we should be doing. And the other one is how do you pick kind of question.
Exactly,
and I think
yes.
you all are asking the latter question rather than the former, which is how do we pick, how do we strategize to understand which approaches, which implementations are most likely to have the best return on our investment.
And I have a question. So based on the needs assessment, and this, I guess the survey will add to that, how are you pulling those things together to sort of then create a list of priorities for those folks to choose? I have a question. I'm working with a couple other states on this type of abatement allocation, and some are program focused and some are allocation distribution focused projects. And so I wonder if you all are going to do a mixture of those, and are you asking for them to say we would rather it be more like a block of funding for this, or we'll all get a little bit of that for this priority?
Thank you for that question, Kathy. So we're a little limited in terms of the way that the regional requirement has to play into distributing out funds. And so a block grant type system model is still technically an option, but I think that's another point, is that we still have all those different options to go through. And that's again why the council, again, in their expertise, decided let's create another working group so that they can digest, what does a block grant look like? What are the benefits or risks or costs of doing that? What's the risks or costs of doing a direct? Or how direct can we really do it, knowing that we have certain limitations within our rules and our statute, or something that's first come, first serve, right? All the different models that exist for the way funds can flow out, to your point, are still also another question to ask. So we have lots of challenges, let's just put it that way. But one of the challenges, again, that we're trying to at least get some questions, some guiding questions for the council when they have to sit and make their decision. If Doug doesn't already know, he and the rest of the council will have to sit in a room and they won't get to leave until they make a decision. But hopefully we can give them some good guidance. And that's kind of what we're bringing to this group today. So looking at other states and how they get to do that, again, my brain goes to, because the attorney in me, well, what rules, what statutes, what system allows for them to be able to do that, and how does that system compare to ours, so that we can maybe adopt something similar, or know that that's just not workable because of all of the changes and hurdles we'd have to go through.
But you start with the need first.
Yes.
You don't, you're not a solution looking for a problem. So
Yes.
I see, Anna, you have a question or a comment. You could please unmute.
Hi, this is Anna Eisenberg. I'm with HHSC. I don't know how feasible this is, but I know that y'all, from your description, have looked at a lot of data and probably will continue to do that. But I think there are a lot of quote unquote real-time events happening right now. I don't know how you can collect data on this or quantify it really, but there are a lot of sort of, you hear of overdoses among youth happening in a certain area, or you hear about certain treatment providers closing. And so I don't know how to get on top of that, but I think if there's any way to sort of get an assessment of what's happening in real time, I know you all can't respond to it in real time, obviously, but sort of seeing those emerging trends that may be affecting certain populations or areas. Now, I know that's hard to do and I don't have a good suggestion for it, but I feel like a lot of stuff has come up recently that has been sort of like, this is happening in this area, this is very severe, how do we respond to it in a better, more comprehensive way? So I don't know how to assess those emerging trends, but I think getting some sort of measure of that, if that's possible.
Yeah, no, thank you for that. And actually that brings me to bring up something I didn't mention in our presentation, but we also made the decision to invest in a data analyst on our team here at the controller's office, acknowledging that, yes, we're collecting all of this data. There's even more data to collect and analyze. And so how do we do that in a digestible way? We need support. As well as our colleagues at HHSC have been so vital. A big shout out to, of course, T-Tor, as being one of the first in Texas to at least to step up and help us tremendously. And everyone that we've talked to, honestly, at HHSC has been extremely helpful. So we know we need to be able to figure out how to analyze the data and in a way that is more meaningful. So that's why I appreciate that both our data analysts and as well as the report that UT Health Houston is providing with the survey of services, they're not just looking at where the services are, they're also looking at how does that compare to the population and the population. So for example, right, in the larger metropolitan areas, we understand that there are more services, but they're serving more people. And so there's still not enough services in ratio to the number of people that they're serving. So I think if that's where you're kind of trying to go with that, Anna, yes, trying to keep up with the trends as soon as we can collect good data. And also I'm optimistic about some of the legislation that was passed this past regular session about hopefully getting better data on deaths and getting that more timely than reported. Hopefully can mean that we can better understand the issue instead of with a little bit more notice and a little bit more transparency.
I see a question here from Kim. If a provider gets city or county funds, can we still apply for funds through application with OAFC?
Thank you, Kim. That's a great question. So again, it's going back to what Doug had said again in the knowledge what the council is attempting to do with these working groups is just that. So going through the notice of funding and figuring out exactly how to outline an eligible applicant. And is that going to more so be tied to the type of entity, or is it going to be more so tied, for example, to the type of strategy that's being funded and prioritized? So some communities may not fit just because they don't provide that unless they're trying to apply in a way that it's a brand new program. So holistically, a city or county that has received funds from the direct allocation is not prohibited. But whether your city or county would be eligible will depend on once that NOFA is issued and one can look at the requirements. But receiving funds does not prevent you from applying, just flat out.
Yeah, I think that's the takeaway is we wouldn't write it as though you get one or the other.
Yes,
It's so.
Yeah, because every entity is getting funds made available to them just about in Texas.
Thank you. Any other questions or comments from our learning community?
I'll make a plug too, before I know we still have a little bit of time, but you know, one thing I really was excited about with this process is to kind of make what we're doing, you know, as transparent as possible, and kind of bring the discussions and the questions that we're kind of asking ourselves in meetings day in and day out kind of to this community. And I think to kind of go off of Anna's question too, of kind of how are we keeping our, you know, kind of ear to the ground of what's going on across Texas with the crisis that's kind of constantly changing, is our stakeholders and partners have been a really key part of that as well. You know, we have heard so much from them and identified trends, you know, like pretty much everyone I've talked to is like, are you going to deal with polysubstance use and not just deal with just opioid use? That feels really important. And so, you know, we're continuing to, Texas is a very big state with lots of different stakeholders in this space, and we're constantly trying to kind of wrap our arms around all of them. So if you have, you know, an organization, professional association, or you think you should be talking to us, definitely feel free to reach out. I'll share our public email in the chat as well. We're happy to sit down and talk more about kind of what we talked about today, and we want to hear from you as well. I'll also make a plug for our vendor intake form that's on our website. So if you provide a service in the community that you think the council might be interested in learning more about, we have a vendor intake form that you can complete to share a little bit more about the services that you offer. And so, so I just wanted to make that plug. And you know, we want to hear from you. We want to talk to you.
Thank you, AJ. I see a question here from Sandra. How small of an entity or an organization is eligible to apply for funding?
Again, great question. Another question that adding to the list of things the council is going to work through. That's again why that concept of that short-term research strategies group is also another to your question, in a way to get the funds out to the door. Is it, again, the how part? So if we create certain thresholds for certain size organizations or certain thresholds or ceilings for funding amounts, is that manageable on the administrative end to then get out funds? So that question hasn't been answered yet, but yes, we are asking ourselves that question and acknowledging that space and that it's possible and feasible, and not to pin large organizations to small organizations. But I see Doug came off mute, so please add to that.
Yeah. The only thing I would really add is we're very conscientious of the regional allocation issue / requirements. We want to be able to have regions that don't have any sort of, you know, treatment / university / big systems infrastructure to be able to apply for fundings and receive funding. Now, it's written, the statute's written in such a way that if there's no applications from small regions, then other regions can use that funding. But that's kind of our, I mean, that's our plan B, I would say. Our plan A is to make sure that we have the people engaged in these areas that in ways that will allow them to be able to apply for funding in ways that maybe they don't have the infrastructure to do currently. So that's something we're thinking about.
And how much support we can provide in terms of any technical assistance or transparency behind the application process to ensure that the resources that are there to understand how to apply. And thank you, AJ, reading my mind, providing that email address. So if you have any questions, we're happy to sit down and go into more detail.
Thank you so much. And in the interest of time, I would request Matt to provide a summary of today's presentation and case.
Sure, happy to do it. Thank you to AJ, Amanda, and Doug for your presentation and sharing, and thanks to everyone else for your comments and questions. We heard a good bit about the Texas Opioid Abatement Fund Council, heard about the flow of funds through the trust fund and then through the council for administration and allocation of these funds. This core question around trying to sort out how best to structure the grant priorities, how to prioritize key strategies, how to think about what are the top priorities, best evidence-based practices, et cetera, as well as the process for determining the decision-making with regard to allocation, issues like the one that just came up, which is accessibility for all parties, so that there's a nice balanced playing field for all parties to be able to get access to the opportunities. There is information on the website. There's the NOFA info, as I understand it, to some degree is already available on the website. Obviously, the details will be worked out through your subcommittees, which you describe to us, your work groups, which you describe to us. And you want folks to fill out the survey, give you more information, and I'm assuming that they can talk to you about the priorities that they have for funding, as well as any advice or information that they may have, guidance with regards to the process for decision making and guidance related to your strategies for allocating funds.
Yes, beautiful. Well said. Better than all of us. Thanks, Matt.
Thank you so much, Matt. And thank you all for joining today's ECHO. And as a reminder, please complete the post-session survey using the link in the chat to obtain CMEs. Please remember to text the code by midnight tonight, the number, and you have the details on the chat right now. We look forward to seeing you on our next session, which will be on Thursday, October 27th. At noon. As a reminder, our new ECHO is launching tomorrow, Behavioral Health ECHO. So we hope to see some or all of you there. So have a good one, everyone. Bye. Take care.